I've heard from a lot of trans folks that were on the list to have consults, to have their surgery later this year, and they received a letter Friday saying that they were no longer on the list.
No longer on the list. Reaction tonight as Vanderbilt University Medical Center abruptly announces an end to transgender surgery at its facility, one of the only in the Mid-South to perform these kinds of procedures. Tonight, we're hearing from local LGBTQ+ leaders who say the hospital's decision is an abandonment of their community. Others say the hospital is anticipating a new state bill that would end state medical coverage funding gender-affirming surgery. In what some are calling an abrupt shift, Vanderbilt University Medical Center confirmed just days ago it would cease providing gender-affirming plastic surgery for adults because of operational limitations and lack of surgical coverage.
Less than 4 years ago, Vanderbilt wanted to be the leading area for trans health, and they started their trans clinic and did so many things to try to be that. And then they started getting some pressure and they started to back away.
Metro Council member and LGBTQ+ Caucus chair Olivia Hill says she's been inundated with calls and questions since the hospital's announcement, leaving some in the middle of a years-long transition process. Advocates say Vanderbilt was one of the only medical centers in the Mid-South that performed this type of surgery.
The next nearest place is a few hundred miles to the south or a few hundred miles to the north.
Darren Johnson with the Tennessee Equality Project also served on the Community Advisory Board for Vanderbilt's LGBTQ health program.
And now we're finding ourselves in a situation yet again that seems to be largely caused by a university medical center that has not stood by the very care that they thought so important to create a robust program around.
I also spoke to conservative commentator Steve Gill, who says he believes the hospital's decision is tied to a proposed state bill to end TennCare coverage of these types of transgender surgeries for adults.
It is because insurance coverage, whether it's TennCare or other insurance coverage, won't pay for it. So what you have Vanderbilt University Medical Center deciding is if we can't get paid for it, we're not going to do it. So it's not really a moral or cultural decision. It's a money decision.
You can come up with 1,000 excuses, and Vanderbilt will try to skirt it around and go like, well, it was this, or it was that, or we're cutting funding, or we had a physician that's leaving. They're not going to come out and say, we just don't want to do it.
And there are a lot of questions about what specific procedures and treatments will still be available at Vanderbilt. Patients having these questions as well. We sent the hospital an email asking for more details and haven't yet heard back. When we do, we'll share that with you. Councilmember Hill says she's now compiling a list of doctors, providers, and insurance companies that treat the LGBTQ+ community in our area.